How do you define burnout?
Evidence that burnout can affect your immune system. There's sections of the brain which are affected and overutilized when you're burned out, and they link to the hypothalamus-pituitary axis, which is part of the brain that controls some of your hormones. And they found that with burnout, just like stress, long-term stress, it impacts on how your body responds to infections.
I was doing a research when I was preparing for this, and I've come across studies from the Harvard, and they say a long-term exposure to stress has long as been known to increase risk of cardiovascular diseases. A study in September 2022 issues of population health suggested it also may raise the risk of dying from cancer. So my question is, can burnout actually lead to cancer, and how in your medical knowledge?
Really, in this country, you should be working perhaps ideally no more than 40 hours a week. We have this working time directive. Sometimes we feel under pressure to take on extra work, and that's when we start to push ourselves to our limit.
Yeah.
So your employer should be giving you breaks during the day, and then you should be having time off between shifts. And they should ideally not work more than a certain number of hours a week. But I know how it is sometimes, whether it's pressures from the workplace because they're short-staffed, or financial pressures, people can push themselves a bit too far.
Okay. How can we identify the signs and the symptoms of sepsis?
Okay. Or the hidden killer sometimes, because it's those symptoms, as you say, you want to just brush them to one side and think, I'll deal with that tomorrow, I'm not going to worry about it right now. So it can be...
We have all heard the word burnout, but what if it is more than just stress and exhaustion? What if it is your body equally breaking down while you're too busy pushing through the pain? In this episode of the Ivy Cancer Podcast, I'm joined once again by a brilliant returning guest, Dr. Jacquie Bell, to uncover the hidden cost on burnout on our body and our mind. From fatigue and brain fog to warning signs we often ignore. In this conversation, we peel back the layer of what burnout really does to our body. And just when you think you have heard it all, things take a shocking turn. Trust me, you'll want to stick around to the end. Welcome to the Ivy Cancer Podcast, where we discuss cancer, lifestyle, and healing, and today it is no different. Before we get into this podcast, there are two ways you can support this channel. First, subscribe. Second, hit the like button on this video. Let's get into the podcast. Dr. Jacquie, welcome again to the Ivy Cancer Podcast. I really do appreciate you taking your time out. You're coming straight from work, and I feel blessed to really have you in studio with us today. Why should my listeners and viewers stay to the end of this podcast?
Okay, great question. You need to stay to the end of this podcast because there are essential things in this podcast which will basically highlight some areas of medicine and health that you may not be fully aware of, but which, if they impact on you, could have a significant effect on you or your family members. That's why you need to stay tuned.
Okay. So listeners, please stay tuned for this podcast. Traditionally, we have a tradition where we normally pray before we get into the podcast, and I think you prayed the last time, so I would go ahead and pray. All righteous and eternal Father, we thank you for this gathering at this present moment, for another educational and insight podcast. I pray that you may give my visitor the words of wisdom to speak to us and help us to open our minds and our hearts and our ears to these words. Forgive us of our sins. In your name we pray. Amen.
Amen.
How do you define burnout?
Okay. So burnout is a phrase that a lot of people use and it's bandied about sometimes. But it's a state of both the physical and emotional exhaustion. So it happens when your mental and your emotional and your physical resources, we all have resources, we have capacity. It's when it's stretched far too far and for far too long. And this can affect any walk of life, any area of employment, but oftentimes it's linked to your employment. But it can be linked to your personal situation as well, if you're a carer for someone at home, for example. So burnout is an overstretching of your physical, emotional, and mental resources.
So could burnout be classified as a mental sickness or a syndrome?
Yep, so we have is something called the International Classification of Diseases. And because burnout has been recognised and experienced by so many people, they've incorporated that as to one of the categories of disease so it is recognised.
Okay. So have you seen any increase in patients or even among your colleagues?
Yeah, so I work as an occupational health doctor, so I look after people who work. And so day in, day out, even just half an hour before I came into this interview, I speak to people who have work-related health problems. I'm also a general practitioner out of hours. So without a doubt, whereas before we used to have things like lead poisoning, mercury poisoning, dermatitis, asthma, these days a lot of the people that come through to us are suffering with mental health symptoms, with stress, with depression, with anxiety, but also with burnout. So that's where sometimes the whole range of things, both in their personal lives and their work lives, has stretched them too far. And the answer is yes, I'm seeing more cases.
Okay. What are some of the symptoms and the signs of burnout that we often overlook and that we should take seriously?
Okay, so the symptoms that give you an idea that you've got burnout would be that you're feeling drained. So each day you wake up, you should feel refreshed and energetic, but instead you feel drained, you might feel unmotivated, you just have not got the drive in you, or you might even feel numb. So you got that thing where you just don't feel anything. Some people might be able to identify with that. And then there's also something called depersonalization. So you become a bit cynical or emotionally detached from patients or your colleagues at work. So they might be talking to you and things that would, stir up your emotions before no longer do that. When they talk to you, you just feel a lack of interest or response to what they're saying. So you become depersonalised. You're not the same person that you normally would be in that scenario. And then also, what we sometimes see is that although you're striving and working long hours, etc., putting in, burning the candle at both ends and putting in a lot of energy, your actual productivity or your outcome of your work or your accomplishments actually might start dropping instead of increasing. And so you start to feel like you're ineffective, you're not getting the job done as well as normal, and then you start to feel like a lack of confidence in yourself, that your skills are not as good as they once were. So these are some of the common signs of burnout.
So for me personally, with what you're saying, I'm wondering if I'm experiencing burnout.
Okay.
Because there are times I'm not certain if it's burnout or it's being lazy. But there are sometimes I get up out my bed in the morning and I feel like I don't want to go to work. Could that be identified as well as a burnout, or it's just me being lazy?
So you say being lazy, but as I mentioned earlier, it's like a burning out of your resources. So that feeling of laziness would typically come after pushing yourself or your strength or your emotional, ability just too far. So yeah, it could potentially be a sign of burnout where you've done a lot for a few days, and then on a day when perhaps you have come to the end of your resources, you just don't feel like you can do anything. So I wouldn't say it was laziness, it could well be a sign of burnout.
Okay. So how can chronic burnout compromise our immune system and it could lead to other illnesses?
So there is evidence that burnout can affect your immune system. There's sections of the brain which are affected and overutilised when you're burned out. And they link to the hypothalamo-pituitary axis, which is part of the brain that controls some of your hormones. And they found that with burnout, just like stress, long-term stress, it impacts on how your body responds to infections. So people who are burned out, I sometimes say to them that you're kind of run down. So the process of burning out can actually impact on the increase of things like viruses and bacterial infections. You might see people getting cold sores or mouth ulcers, even hair loss. Your immune system is no longer as resilient as it would normally be when you are well and everything is balanced.
So mouth sores have something to do with burnout?
Yes, I gave that as one example, but multiple infections and your immune system as a whole can be affected by burnout. So your body, normally your white cells are there to fight off various types of infection. But when you're burnt out, the way your hormones are balanced is not the same as normal. And when your hormones are not balanced, your body isn't responding in the same way to chemical messengers or to physical attackers such as infections.
The reason why I ask, because from I know myself, I always have which side I can't remember. One side of my mouth, always have cold sores.
Okay.
Growing up, and I used to label it as night fever.
Okay.
Growing up, and it's something that I used to have on a regular, sometimes 3-4 times per year. On a regular, just come up, and if I touch it, it even spreads.
Yes. You're not meant to touch them.
Right. So
it's actually got a live virus in there.
It's just since in my adult stage I realized I shouldn't be touching it. But you know what I mean?
But the temptation is to touch it because it's itchy and irritating.
Right.
Yeah?
So when you say that to me now, when I've seen it flare up, I can realize your body's saying take a break.
Take a break, yeah.
Whoa. So much.
But when we take breaks, really, in this country, you should be working perhaps ideally no more than 40 hours a week. We have this working time directive. Sometimes we feel under pressure to take on extra work, and that's when we start to push ourselves to our limit,
Yeah.
So your employer should be giving you breaks during the day, and then you should be having time off between shifts. And they should ideally not work more than a certain number of hours a week. But I know how it is sometimes, whether it's pressures from the workplace because they're short-staffed or financial pressures, people can push themselves a bit too far.
Okay. But funny enough you say that, because I have to ask you about work-related and burnout as well. But since you mentioned it, let's just skip to it. Like,
Sure.
If we're facing burnout, what are the measurements or the steps that we can take that legally protect us as workers against employers?
So when you come into a job, you have a contract of employment, and you should have a job description, and that outlines how many hours you're supposed to work and what work you're supposed to do and who you're supposed to work with. You should also have training in your health and safety, the measures you must take to protect yourself from the various hazards you meet in the workplace. So straight away there's some documentation which you should have, So sometimes people start a job and they never get the contract signed, they never get the documentation. They may have had some of the training, but they may not have been signed off. So you need to make sure that all of your induction is completed and you have all the necessary documents for your contract of employment. So once you've got those, in theory, then the employer should be sticking to what's on that paperwork. So we don't want unscrupulous employers. We want people who are employers that look after their staff, because people enjoy coming to work. They feel that they're productive and contributing to society.
Right.
And the employers want to encourage them to do their part, to use their skills.
Right.
So if you are thinking, hang on a minute, I don't feel right, I don't feel well, I'm beginning to feel depersonalised, I'm beginning to feel drawn, I feel tired, I'm lacking motivation, I'm not enjoying life, I feel numb, all those signs of burnout, then you should actually perhaps try to pinpoint what it is. So I'm going to say that it may not just be work, but work may be a big contributor, because I think I mentioned last time that we spend about 75% of our waking hours at work.
Right.
So the rest of us are spending 8 hours a night sleeping, ideally 8. And then you've got this other time where you might be, eating, driving, doing some homework. But a lot of the time you're spending is actually at work.
Right.
So you then need to think whether it's work or whether it's something else that's causing these symptoms. And if it is work, you need to pinpoint which aspects of the work. So the Health and Safety Executive, who are the body that actually prepare the legislation for employment law and employment health and safety, not the law so much, but not all the law, but the health and safety at work, they have recognised stress as one of those factors that can cause health problems. and stress is linked to burnout. And so what we looked at is they've looked at 6 areas of your work, which are the key things that we found are the contributors to burnout or stress. So one is the role. So I mentioned that documentation that you have, which says what your job is, what you're supposed to do, what hours. So ideally you should be sticking to that role. Sometimes people find that the role is too much, overstimulating. In other words, they've got more on their plate than they should have.
Right.
Or sometimes they're understimulated. They haven't got enough to do. They're twiddling their thumbs. They don't feel utilised. They don't feel stimulated. And that can also be stressful. So that's the role. The next one is control. Do you have control of what you do at work? So I don't know if you ever feel that the work is out of control, but you're here, you're there, you don't know whether you're coming backwards, forwards, you don't know whether to prioritise, what to prioritise. And sometimes when you make the wrong decision, people say, well, why didn't you do that first? You may potentially not have control over your workload.
Right.
The next one is workload. I said the role, I've said the control, but the workload itself. Let's say it is all on your job description, but there's just too much of it. You might be trying to do the work of 1.5 people, 2 people, or even 3 people. So that workload can be excessive. So that's another factor where you think, I've got to get my work done every day, but you're really working very hard, too hard to actually achieve that. And then again, could lead to burnout.
Okay.
Then you've got change. So change is one of those factors, whether it's changing location, changing managers, changing jobs, redundancies, losing your colleagues, all those factors can actually impact on your levels of stress at work as well. And then there's relationships. So sometimes people feel intimidated by their colleagues, bullied, harassed. Gaslighted is a common phrase I hear these days. Undervalued. So, people, the way they treat you at work can make you feel stressed as well. And that stress can lead to burnout. So I've mentioned the role, the control, the demands, change, the relationships. And the other one is support. So when you're in the workplace, if you've got a problem, whether it's that you need some time off to go and get your health checked or go to your child's school assembly or whatever it might be, see the teachers, visit an elderly relative in hospital, or need a change from work or need support because someone's not pulling their weight or someone's bullying you, you want to have support from your managers. You also want support from your colleagues. So if you're all a team together, you want everyone to pull their weight.
Right.
And if you're a manager, you want your team to support you by doing their part in the whole process.
Right.
So that's the support side of it. The role, control, support, demands, change and relationships. And I know I've changed the order there a little bit. But those are the 6 things that the Health and Safety Executive have recognised as work-related stressors, things that in the workplace that cause you stress.
Yeah.
So I think that answers your question.
Yeah. So I asked, what are the steps could we take as an employee to the manager?
Okay.
So let's say, for instance, you're feeling like you're in a burnout, kind of mood,
phase,
or you're going through burnout. You can identify it. The stress that burnout causes. What can happen to burnout? You report it to your manager. Like, listen, I feel like I'm overworked.
Yeah.
And I think I need some help.
Yes.
But they do not budge. What steps can we take to, legally keep our jobs, but at the same time take action for our own health benefits?
Yeah. So it should be a manager that takes on some understanding,
Right.
To support the process. But there's a document called, or a process called, a risk assessment. So it looks at each of those 6 areas to see which ones may be present in your situation. It gives them a chance to weigh up how significant each of those ones is, and then a chance to make changes. So whether it's to reduce your workload by half, or to ensure that the person who's speaking to you rudely recognises the policies where you're supposed to respect your colleagues. So the manager should help you. Now, if the manager isn't helping, you can speak to your union representative if you're in the union. And otherwise, you can seek legal advice. Sometimes Citizens Advice Bureau will give you legal advice for free.
Okay.
So those are some of the measures you can take. Sometimes people go above their manager if it's their manager that's causing them the stress. So they'll go to the senior manager above their own manager if they feel that the person making their life difficult is that immediate line manager.
Okay.
So that's the process. If it has to escalate, you can ultimately get to the point where you feel you have to leave a job because they haven't made the changes you've requested. And if there's a situation called, or a legal phrase called, constructive dismissal, where in spite of your writing to them, because things need to be in writing, in spite of you asking them, they haven't made changes. And in the end, you feel like you've got to leave the job because, in a sense, it's killing you, in inverted commas, you know. And then, in theory, you could take an employment tribunal case for constructive dismissal. So that would be the very, ultimate or the last step you would take.
Good information. Can burnout lead to a misdiagnosis of illness, medical mistakes?
Well, the thing about medicine is it's a long career, obviously, in terms of how long it goes back in years, in centuries, decades. And the process of medicine really should be that we take a history first. We talk to the person what's been happening, what their symptoms are. Then we should ideally do an examination. So that might be blood pressure, height, weight, listen to your heart and lungs, feeling your abdomen, so forth. And then ultimately we might take bloods or do an X-ray or a scan. So even from the history alone, it says, I'm tired, I've got no energy, I've got no motivation, I'm not enjoying life. Those things start to give the doctor an indication that it's a mental health condition, because in a sense, burnout is a mental health, even though it's got physical aspects and emotional aspects as well. So the doctor should be able to diagnose from what you tell them, and then subsequently the examination, where let's say your blood pressure is high, that can be a sign of burnout and stress. But the doctor pulls together the different parts of the jigsaw to come to a diagnosis. So the misdiagnosis, it means that a mistake is made, a mistaken diagnosis, as it were. So, yeah, I guess that some symptoms of burnout, people might think, it's an underactive thyroid gland. But as I say, if we start with those fundamental steps of asking the person what's wrong, what's been happening, and try to look at all aspects of that person, really from head to tail, but also their work lives, their home lives, their habits, smoking, alcohol, drugs. We then can build up a picture, even from the history alone, what they tell us, in other words, as to what the problem is. And those other tests go on to just confirm what the doctor was thinking. I don't know if I've answered your question.
Yeah, because it's often, doctors mistake a diagnosis for something else. And, I've seen where burnout could be mistaken for something else, or a normal or something serious could be mistaken because of burnout. So, how can you draw the line between normal stress and harmful burnout?
It's a really good question. There is a bell-shaped curve. I mentioned this before. So we're all different, aren't we? We're all built differently. By God, we're fearfully and wonderfully made, though. We're amazing creatures, God's creation. But each of us is different. So I've admittedly had quite a stressful day today. I can't deny it's one of the most stressful for this last 6 months today, because suddenly 3 extra meetings popped up and they were all important, for me today. And I also had this book from some time ago. So we're all different in terms of how we handle stress. So what one person can cope with, another person would be flattened by that.
Right.
They possibly need a week or 2 to recover, but the other person's coping just fine. So you have to look at your own tolerance or resilience to determine what level of stress you can cope with as an individual. And I guess you get that, you learn that through life. You'll see people around you who can do 4 times more than you, but that doesn't matter. If you can only cope with 1/4 of what they can do, and that's your tolerance, that's what you stick to, because we're all made differently.
Right. Right. So, like, what kind of preventative measures would you recommend for patients and professionals?
Yeah, well, the 8 laws of health that we adopt as Adventists is an important first step, We use the New Start abbreviation. We look at nutrition, exercise, water, we look at sleep, we look at fresh air, we look at trusting God, we look at temperance. I've probably got them in slightly the wrong order. But rest is also in there as well, and the Sabbath day, keeping the Sabbath day is beneficial. But if you can stick to those, then you're off to a good start, Evidence has shown that people who adopt these lifestyles can live between 7 and 11 years longer than people of exactly the same age who do not adopt those measures. So that's nutrition, so a healthy diet, exercise, water. I didn't. I've said sleep, but I think it's S is for. I'll come back to it. I think it's sleep, temperance, fresh air, rest, and trusting God. I've now got the S wrong, but look, it might come back to me. So that's the first start. Do that first if you want to build up your personal resilience. Then, whatever you take on, make sure it's within your capabilities. Make sure that you've actually got adequate experience or training. So if you start stepping into deep water to do something that you're not trained to do, you're automatically setting yourself up for something that is going to cause you stress. Oftentimes the training can be gained from people around you who are experienced. So whether it's your boss or university or college or course, that will prepare you better to deal with what you have to deal with.
Oh, okay.
And then you need to sort of look at what you can cope with, the individual resilience factor, and only do what you're able to cope with. If your manager says to you, or the person supervising says, oh, that's not enough, you can look at the thing, look at the situation again. But do what you're capable of doing, take your breaks, and try not to overwork, in other words, put in more than your shift reasonably allows. So, 8 hours, I think, is a reasonable amount of hours per day. 40 to maybe 55 hours per week is a reasonable number of hours per week. I mean, it varies.
So could that be the reason why the Adventist movement listed in the Blue Zone? Yeah. So they practice the 8 laws of health. Yeah. That's
without
interesting.
a doubt. And again, I know there's been a fantastic documentary which looked at the Blue Zones, and the Adventists were one of those populations that were included because of the health laws that we adopt. Interesting.
So I was doing a research when I was preparing for this, and I've come across studies from the Harvard, and they say a long-term exposure to stress has long as been known to increase risk of cardiovascular diseases. A study in September 2022 issues of population health suggested it also may raise the risk of dying from cancer. So my question is, can burnout actually lead to cancer, and how in your medical knowledge?
Yeah. Well, that particular study, which you did share with me beforehand, thank you for that. It goes on to say that the investigators looked at health information, including body mass index, that's your weight and your height, blood pressure, which we all know about, your total cholesterol, we know about that too, your blood glucose, and something called a C-reactive protein, which is a marker for inflammation in the body. And they looked at 41,000 participants in the National Health and Nutrition Examination Survey. And based on this data that they collected from these 41,000 people, they actually found that the researchers found that something called the allostatic load, that's a cumulative effect of stress over time. Scores range from 0, so a very low allostatic load, so all those things I've mentioned to you were normal, good, to 9. So you could go from 0 to 9. And if your score was higher than 3, it indicates that you had a high allostatic load. They then looked at these people in the category of 3 and above and determined how many of them later died of cancer. And they found that those with a high allostatic load were 2.4 times more likely to die from cancer than those with a low allostatic load. So they're saying the connection between stress and cancer could be related to the body's exposure to cortisol. So cortisol is a hormone that's released from the adrenal gland, and it's actually how we respond to stress.
It's a stress,
so it's a stress hormone, yeah?
Right.
and the body releases it during stressful events. So my cortisol today would be higher than normal. But it's kind of basically preparing all your organs to function at their highest level. It's like having a car and revving it fast all the time. You can't do that.
Right.
Sometimes you want to take that car slow so it can last time.
Right.
If you rev it hard every single day, it's going to burn out the car quicker, the battery, everything's going to go quicker, the brakes and everything. So if you keep it consistently high, which is what happens in burnout, consistently burning yourself down, burning yourself out, wearing the body down on a cellular level, they felt that was the reason why, with this high cortisol level, which is a marker of stress, that they felt that this was linked to a raised cancer risk. And also caused existing cancer, if you already had cancer, to cause it to spread more aggressively and more rapidly. So that's what that study highlighted. It's not my specialist area, but it does seem possible and probable and realistic that this is a factor.
Yeah, because when you mention about with the stress level with your high cortisol, I can remember having a interview with Dr. Amanda, and we were on the topic of stress and how she linked stress with raising your cortisol. Yeah. So yeah, it all makes sense. So it's good to listen to your body, in other words, and take a break, know when to stop. You know, a friend of mine at church, he said to me that his dad been doing 2 full-time hour job.
Yes.
And he wants him to take a break, but doing 2 full-time job, especially when you're up in age, that couldn't be healthy, isn't it?
That's right. So that's talking about working 80 hours a week potentially, you know?
Yeah.
And as you say, as we get older, our bodies are less resilient. So there's things we can do when we're young, and I remember being younger.
Yeah.
But, now when you think about it, it's sort of, you think there's no way I could do that anymore.
Right.
So it's not good for the body, you know?
Right.
It's not good for the body to do that. And do you remember I said to you the allostatic load was those things that they measured it by looking at the blood pressure,
right,
the body mass index, the total cholesterol, the blood glucose, and then the C-reactive protein, which is a measure of inflammation.
Right.
And I mentioned those 8 laws of health.
Right.
Those 8 laws of health link to a lot of those factors, those allostatic load factors. So when you come to a health expo where we check those 8 things, we check your weight and your height, and we work out your body mass index. We also sometimes work out your percentage of body fat. We check your blood pressure. We check your blood glucose and cholesterol sometimes at certain expos, not all the expos.
Right.
But we talk to you about your nutrition. What do you eat nuts and healthy food? Are you vegetarian, or do you eat a lot of meat? And we talk to you about rest, the importance of rest. And not overworking yourself. Right. We talk about temperance, So in this day and age, you can get anything you want when you go to the shops, almost anything. Right. And even outside the shops, you can get other things that, are bad for you. And so temperance is really important, not to overdo those harmful things. And then trusting God. So that day of rest and the trust in God. And that's almost like listening to yourself, isn't it? When you trust in God. The Holy Spirit kind of guides you and says, hang on a minute, that's not right.
Take a step back.
Yeah, take a step back or stop or get some rest or pray,
Pray.
So I think that the health expo, the health message that we have, the process, the New Start algorithm and process is a good thing that really does tie in with this Harvard study.
Oh, okay. Recently, I've come across this lady. I think her name is Christine or Catherine, something like that. I came across a story on TikTok. Oh, okay. But before, I've read something in the paper about her story. She was in, I think it was Spain. She and her family was enjoying holiday, and she got a stung or something like that, and they didn't pay any mind. But when I looked into her story deeply, listening to her talking about it directly, you get to understand that she had a untreated infection. And that lead to having sepsis.
Sure.
So, can you walk us through what is sepsis and how can we get diagnosed? How can we identify?
Okay. So sepsis, for all doctors, nurses and healthcare professionals, is a really important topic. It's actually a life-threatening condition that occurs when the body has an extreme response to an infection. Okay. So instead of just fighting the infection, the immune system goes into overdrive. Yeah. And it starts damaging its own tissues. So imagine your own body damaging your own.
So is it like what's it called? Lupus? Is it autoimmune?
So lupus is an autoimmune condition, and that's to do with antibodies produced by the bone marrow, which cause like a chronic illness. So the person might notice a little ache in the right knee one week, a little ache in the left shoulder the next week, and then they may ignore it, or they may choose to go to their GP, or they may choose to go to A&E. And the doctor might write it down and say, take some paracetamol, ibuprofen, but then 3 months later it occurs again. So that's like called insidious. It comes on gradually. Yeah, lupus does. It's very rare that lupus hits with the full-blown serious impact, such as kidney failure, straight away. There's warning signs. So people again need to listen to the bodies, and if you've got symptoms that aren't right, that weren't there before, speak to your doctor. Sepsis, on the other hand, though, is this overwhelming, it's an infection. So the body goes into overdrive and starts damaging its own tissues and organs. And it gets to the point where it's life-threatening.
Right.
But if it's treated quickly, people can actually avoid getting the serious complications of sepsis and the potential risk of death from sepsis.
Okay. I was looking on the WHO, and they have a data that published from 2020 that says 48.9 million people were diagnosed with sepsis, and 11 million was sepsis-related death. To me, as a Jamaican, that never used to really hear about sepsis, come to the UK and hearing about sepsis, it's a regular common thing in the UK to hear that someone has been diagnosed with sepsis or someone that passed from sepsis. So when I've seen this alarming figure to know that so many people died from sepsis, like, can you just like give us before, because you were supposed to list some signs, but
Didn't forget to give you the signs.
Yeah, but before you give me the signs of the sepsis, like what are the mortality rate for sepsis?
Well, as you mentioned, that World Health Organization study, which collected data from 2017 but was published in 2020, because it takes time to collect the data, so it's always a few years later.
Yeah.
The mortality. So that's sort of, if you look at the fact that there were 48.9 million cases and 11 million deaths, that's like one in 5, 1 in 4, or 1 in 5 of people that get sepsis could actually die from it. Now we're looking at the whole world, and obviously you've got different countries with different facilities and different access. And although you never came across it specifically in Jamaica, I suspect there were cases happening in Jamaica.
Yeah, there were cases, but growing up, because when you get a cut, it's simple, like you just get some alcohol and pour on it and you're gone. But I realize sepsis is just even more than that.
Oh, much more.
Yeah, but it's there, but I don't hear about it like how we hear about it here in the UK. It's like when my knowledge was open to sepsis was when I'm in the UK.
Okay, yeah. So you may be thinking of sepsis because every time you see an ambulance drive past,
you see the sign sepsis.
That word is on there.
Right.
And again, we've had this COVID pandemic, which has heightened people's awareness of disease more than ever before. suddenly talking about disease was an everyday occurrence in our lives during that pandemic.
Mm-hmm.
So people are more interested in health now since the pandemic, and some of the people that died during the pandemic would have actually died from sepsis as well. It's an overwhelming response by the body to an infection, and that's what COVID was.
Mm-hmm.
So yes, it's a high mortality rate, and the thing about it in medicine and nursing is that we treat it as one of the top medical emergencies.
Right.
So we have training on it, and we're told about the signs and symptoms and how to respond.
Mm-hmm.
So we have to think sepsis. So if we see a case and we're suspicious, we have to think, is this sepsis?
Mm-hmm.
We have to speak sepsis. So we have to say to somebody else, I think this could be sepsis. You don't just keep it to yourself.
Mm-hmm.
And then we have to act on it as well.
So do you think in the NHS
Yes.
or in the medical industry, they
Yes.
pay enough attention, or they've been trained the right way? Because I've heard about cases where, like this lady, she brought her son to the doctors because he was having high fever,
Yeah.
and they just give him some paracetamol or whatever, and they send him home, and they call and it's like, the fever is not down, what should we do? And they said, just give him a next dose.
Yeah.
It reached to the point where they had to take him back to the children's hospital, and they just rush him up, give him whatever, and send him back home. And within a couple of days, he passed, unfortunately.
And
when
it
they
was sepsis,
and
yes.
it was sepsis. So, do you think that the medical team are, properly trained, every one of them, or to analyze it?
We talked about burnout, and we talked about, I said there could be different professions that this could affect, and without a doubt, doctors are human,
Right.
nurses are human, and the resources sometimes are such that people might feel burnt out.
Mm-hmm.
And we talked about burnout now as a potential risk factor for sepsis, so we talked like full circle.
Right.
So my impression is that yes, it's the training is good.
Mm-hmm.
The facilities in the UK are exceptional, even though the resources, the staffing may not always be at the top level.
Right.
But if you take yourself to other parts of the world, you're not going to find a hospital every 10 miles. You're going to have to travel 30, 40, 50 miles. And when you arrive, if you don't have medical insurance or money, you may not get treatment.
True.
So you've got to bear in mind that we're in a first world country here.
Mm-hmm.
And we get training. We have mandatory training on certain things. And sepsis has been one of those high-level, important areas of training.
Mm-hmm.
So I'd say, in short, the answer is yes. But like with anything, every single case has its different factors. The factors that cause that case not to be as successful as the next case.
Right.
In terms of the outcome. It may be that the individual has a lowered immune system to start with,
Mm-hmm.
So even as a child, you can have a lowered immune system.
Mm-hmm.
It may be that the medication was not at the right dose.
Mm-hmm.
It may be that they weren't examined. Maybe it was telephone rather than face-to-face.
Mm-hmm.
It may be that there was a delay in getting to the hospital. Traffic or road traffic collision or some other thing may have stopped the person getting to the hospital at just the right time. Sometimes if you come in half an hour later, this could have been a different story.
Mm-hmm.
So I'm not denying there may well have been multiple interactions with healthcare professionals which didn't, which perhaps did not recognise the sepsis.
Mm-hmm.
I think you can ask me for some signs and symptoms of sepsis.
Yeah, because I really would want to know, because you wouldn't want to pass the signs and ignore them, because, as I said, as a Jamaican, if certain things happen, we just brush it underneath the ground and try and sort it out for ourselves. You know what I mean? Yeah. So how can we identify the signs and the symptoms of sepsis?
Okay. So it's actually called a hidden killer sometimes, because it's those symptoms, as you say, you want to just brush them to one side and think, I'll deal with that tomorrow, I'm not going to worry about it right now. So it can be a fever. So fever is a very important one. Or it can actually be a low body temperature as well. So there's a normal range of temperature, and if your temperature is too high and won't come down, or too low and won't come up, that can be a sign of sepsis. Rapid breathing, or difficulty breathing, It can also be that the person's confused or disorientated. So I don't know if you've ever seen that, but people sometimes who have an infection can actually be quite confused.
I've never seen that
Even
before.
a urinary tract infection, particularly for older people, can cause them to be confused. sometimes the first symptom we see of a urine infection is the person's more confused than normal.
But before you carry on,
Yeah.
what would cause the confusion though?
Okay, good question. So I guess it's the actual process of the infection on the whole body, because an infection is not always just the cut.
Yeah.
It's getting into your bloodstream. Even with a urine infection, your body's reacting to that infection. It's trying to fight the infection off.
Okay.
But that's a good question, and I think there's a more technical answer than that.
Yeah.
Involving hormones and enzymes and things like that.
Yeah.
But as I say, particularly in the older people, sometimes when the first signs of an infection is the fact they're confused.
Okay.
And their relatives come to recognise it, say, oh, she's confused again.
Mm-hmm.
I think it's a urine infection. But anyway, so confusion or disorientation. They can have a clammy or sweaty skin.
Mm-hmm.
Yeah? Can you imagine cold, clammy skin or very sweaty skin?
Mm-hmm.
The skin doesn't feel the same as normal.
Mm-hmm.
And then there might be an extreme pain or discomfort as well. In children, they can also have convulsions, like seizures.
Right.
They can have cold limbs, so the body's hot, high
Mm-hmm.
temperature, but the hands and the feet are cold.
Okay.
We call it the peripheries. They may have difficulty walking, or they're not eating as well.
Oh.
So when a child's off their food, sometimes the parents
We
worry.
just need to pay attention. Yeah.
So there's an abbreviation or acronym that can be used for sepsis, which is S is for slurred speech or confusion. E is for extreme shivering or muscle pains.
Mm-hmm.
P is for passing no urine in a day. So that's a worrying sign as well.
Definitely.
Kidneys have got to function, haven't they?
Definitely.
Yeah. And the other next S is for severe breathlessness. It's really, the I is it feels like you're going to die. And the S is skin, mottled or discoloured.
I was just about to ask because the lady said she had seen discolored around the area that she got bit.
Bitten, yeah.
Yeah, but so it's so ironic because with her stories that the bite that she got,
Yeah.
I don't know how to work it out, but they lead the bite to an untreated infection. So could it be that the bite, well, she did specifically say it's an yeast infection. I think
a yeast?
Yeah, I think it's a yeast infection, vaginal infection.
Oh, yeah, okay.
Right, so she's specifically, but why happened when she got the bite? Because they had to air ambulance her back to the UK.
Okay, well.
And she lost all her limbs.
Yes, that's the problem about sepsis.
So how fast sepsis can spread though?
Again, varies from case to case, depending on the severity of the response by the body. But yeah, as I say, it's a medical emergency. That's one thing an ambulance should not delay in collecting a patient with if we suspect it's sepsis. And bear in mind the person's at home with their mother or their grandmother or their brother or sister.
Right.
He's thinking, well, they've got this they've got this symptom, they've got that symptom. Who do I call? Do I call the GP? Do I call 111? Do I call A&E? Do I call 999? And all that takes time to process. So what I was saying to you is that it's a medical emergency. If you've got any suspicions that it might be sepsis, you need to act on it very quickly because it can spread. We sometimes say in children within a few hours. Yeah, so I'm an out-of-hours GP, so we deal with these cases sometimes, and we have to get that person to hospital as an emergency.
So who is at risk for getting sepsis?
Yeah, who's at risk in particular? So I'd say the children and the elderly and those with immune conditions, low immunity, and those people who perhaps have things like renal disease, kidney disease, people who have diabetes as well. Those people tend to be at slightly higher risk than the average person. So people with cancer as well, people living with HIV. Women who've had babies as well, in that short period after having given birth, they're also at risk, unfortunately.
Oh.
Yeah.
Oh, okay.
So I'll just repeat that then. So babies and children under 5, people over 65, and those with weakened immune system. So there are quite a few people like that. They're like cancer patients because the medication they're taking impacts on the immune system. People living with HIV, people with chronic conditions like diabetes or kidney disease, and women who are either pregnant or recently given birth. We call that period after giving birth a puerperium, when lots of things can go wrong. You've given birth, you've got a lovely baby, that 9-month wait is over, but that period after birth is a very, very important period of time. Those sort of 4 or 5 weeks.
Could that be some of the reason why a lot of women, the doctors would probably check their placenta just in case if there's any fever or anything like that?
Yep. So when you give birth, obviously some people are giving birth at home.
Yeah.
Some people are giving birth in special maternity units, some are giving birth in the main hospitals. But yeah, the professionals looking after you check certain things, certain criteria.
Mm-hmm.
The placenta's checked just to make sure it's complete, and I've actually done that work myself.
Mm-hmm.
You take the placenta, you spread it out on the surface, and you make sure there's no bits of it missing.
Oh.
It's like laying out a large pizza.
Okay.
It's that sort of size.
Okay.
And you're going to make sure there's no sections missing, because that section that's missing could be inside the woman.
Mm-hmm.
And if that's inside, that can increase the risk of an infection.
I want to, because of time,
Yes.
I want to fast track my questions.
Sure.
But before, this question is really important to me. Like, is there a way that we can prevent ourselves from getting sepsis?
Mm-hmm.
And if we identify sepsis, what are the steps that we should take?
Okay. So prevention, that's a word that we know a lot about now as well.
Mm-hmm.
Good hygiene.
Mm-hmm.
So keeping wounds clean. If you get that cut, clean it with the alcohol. Keep an eye on it. Cover it with a dressing if necessary.
Mm-hmm.
Then there's vaccinations. I know that's a sort of ambiguous topic, yeah. But vaccinations are there to prevent, guess what, infections. Because we've known over the years that many types of infections have led to large parts of the population dying,
Right.
whether it's or getting serious illnesses,
Mm-hmm.
Then early treatment of infection. So you've got a cut, it's not healing, it looks oozy, it's oozing something, or you've got a chest infection, or you've got a urine infection. Get that infection treated early. Don't just sit on it and keep an eye on it. The whole point of medicine, really, God's given us this gift to be able to make medicines originally from herbs, and now obviously much more sophisticated, but it's to fight the infection more aggressively than your body can fight it.
Okay.
So also the hospitals have to be very careful about how they manage infections as well, because some infections only occur in hospitals because it's
Right.
that environment where the common organisms don't survive,
Right.
but the rare aggressive organisms do survive.
Oh, okay.
So they have to be very careful to manage infections in hospitals.
Mm-hmm.
And also, sometimes we're giving out antibiotics more than we need to. So people get a slight cough, it's actually a virus.
Mm-hmm.
But they're begging the doctor for antibiotics,
Is it
I
true?
need antibiotics.
Is it true that our body should only take up to 2 cycles of antibiotics per year?
It's a case-by-case basis.
Okay.
Maybe that's the ideal for someone who's perfectly healthy, but if you're an asthmatic or you've got chronic obstructive pulmonary disease, you might need more than that to keep yourself alive.
Okay.
And don't forget, so everyone's immune system's different. Any other fast-fire questions?
So, in your knowledge,
Yes.
do you know of any case where people would get fully recover from sepsis?
That's a good question, because sepsis is not only a physical condition,
Mm-hmm.
there is also a psychological element to sepsis.
Mm-hmm.
When you, like I said to you, one of the things is that you might feel that you're going to die.
Right.
So with that feeling, you may well end up in A&E, in an ambulance, 999, blue lights, and then be in hospital. You might even be put into ICU. And, that near-death experience can
Right.
actually be quite traumatic.
Yeah.
And some people get a post-traumatic stress disorder from sepsis.
Yeah.
So I've come across people who've lost fingertips or their nose, and as you mentioned, people lose their limbs.
Mm-hmm.
So I wonder if the recovery, there must be some research out there, I suspect,
Yeah.
that talks about whether you ever fully recover from sepsis.
Yeah.
Because what then happens is the next infection you get, you're worried straight away that it's going to also lead to sepsis. There's something about your body that reacts to a common infection in an extreme way that another person wouldn't react to it. So you're going to then be worrying about the next infection. I get that. People say, I've had sepsis 3 years ago. I'm worried about this new infection.
Right.
So do you ever fully recover? Great question.
Yeah. So that was supposed to be one of my first question. Whereas, what recommendation would you give as an advice for someone that's going through post sepsis? Like, what would you recommend to them? As you said, it can be a traumatic experience as well.
Yeah. I mean, you're relying on your network, so you're relying on your family, your friends, your church. You're relying on your relationship with God if you're a Christian, and trust that God will get you through this situation. You might also be relying on your work arrangements, your employers, to be understanding that, you've got over the worst of it and you're hoping to come back to work, and work is an important part of your identity, So I hope that answers that question. So sometimes just keeping that network around you is really important.
Okay.
So be nice to each other, be nice to people, because you never know when you're going to need them,
So the last question is, what is the biggest misconception and myth that surrounds sepsis that you hear?
Is there one? Well, I did say it's the hidden killer. So what I'm going to say is it's not always obvious that you are heading towards sepsis. So if it doesn't feel right, whatever it is, don't delay when you've got an infection. If it doesn't feel right, don't delay. It's not going to be an obvious, sign. It's going to be subtle, accumulation of several subtle different things, which can only be picked up by medical professionals, nursing professionals. Okay. So I'd say don't think it's going to hit you like a bolt out of the blue. Be suspicious, and if it doesn't feel right, get it checked. It's a hidden killer.
Okay. Dr. Jacquie, thanks again for another informative podcast. As you know, we have a tradition of opening and closing tradition. And our closing tradition is the guests leave an encouraging word for the next guest coming up, not knowing who that guest would be. And your encouraging word comes from a herbalist that I've interviewed last. Her name is Violet. And she said, weeping endure for a moment, but joy comes in the morning. And when she sent me that encouraging word, I said, you know what? This is a woman of God, so I think this would definitely fit well with her. So thank you again for coming in. And as you know, you probably write your encouraging words, or you can probably send me a text message for the next guest coming up.
Yeah, I'll send it through.
Okay, thank you. Thank you once again for the NEC to allowing us to host this podcast in studio. Studio is available for especially for Adventist members to use, and it is also open to the public. You can contact them on the information that I will be listing on the screen. Until next time, stay safe, stay blessed, and eat healthy.